Most of these people go through this even at a young age. They're not detransitioning and they're not regretting their transition. Now, when I look at medical intervention for children when it comes to gender dysphoria, I look at a few things. One, I look at what the consensus in academia is telling me, and that's going to be from doctors, psychologists, endocrinologists, counselors, things like that. And the evidence that they're telling me is yes, this is a beneficial way for us to combat gender dysphoria. I then look at, okay, now let's look at the safety and efficacy of the treatment. And when I look at the safety and efficacy of the treatment, I show that it is a safe and efficable way to do this. And then I look at, okay, now let me think about if I was a parent of a child who had this. If I was a parent of a child who was gender dysphoric, and to an extreme degree to where they were getting comorbidities like depression, anxiety, and other mental health issues, or if they were had suicide thoughts or were experiencing suicidality, and if they were experiencing self-harm or contemplating self-harm. Well, I would say, okay, I now have to make a decision. I have to make a risk-benefit decision. I have to look at my child, I have to look at the treatment, and I have to say, does the risk of this treatment outweigh the benefit of this treatment? And I would probably come to the conclusion every time that the benefit of my living child outweighs whatever the risks are. 100% of the time. Now, knowing this, knowing that there are people that do regret their transition, they do exist, my way to combat this is to make education on gender, on transitioning more easily available. Make it so that people are not just getting their information from online sources. Make sure they have access to mental health counseling, to gender counseling, to all of these things so that they know, they're not just going, well, I'm trans because all my friends said I must be trans. Some people who feel like they are trans may end up not needing gender affirming care medically. Social transition may be enough for them. There's a litany of factors, but the way that we don't combat it is by just removing gender affirming care for these people. That's not an effective way to combat it. And all we're going to see from that is a rise in those comorbidities that I talked about earlier.